Hope you're enjoying your week so far. Just wanted to run down a video of a CT abdomen with contrast. Kind of go through start to finish. That way you can start to break down some of these important structures that are associated with the abdomen. So let's get started. So when you kind of look at these structures, of course, we have our scalp-based image to kind of give us that localization. We can use these localizers as well. So make sure you kind of do that. Like I said, as before, I've set the coronal plane and the sagittal plane at kind of areas that I think are a little bit more helpful. That way you can kind of just keep that frame of reference and kind of see exactly where we're actually at as we pan through the images. So I'll go from the superior aspect down through the inferior aspect, touching on some specific structures kind of as we channel through. So, and as we continue to kind of go down and get closer to the region of the diaphragm, I want you to just kind of note initially this structure here. So that what we were seeing here is the region of the IVC. So the IVC is the first thing that I'm really going to kind of follow. That way you can kind of get that frame of reference, see exactly where it's at, the inferior vena cava. And you can kind of see it right there. It becomes nice and clear. As we continue to go in, it's starting to kind of blur in with some of the contrasted structures of the liver. But nonetheless, you can still see that circular-based region as we kind of continue to go down. So additional structures that I mentioned that I really wanted to emphasize kind of going forward is I wanted you to be able to see how that divides off into articulate out with the renal vessels. So the renal vein is right in here. You can see respectively this would be carrying over to the left renal vein, and you can kind of see that connection actually really well on that particular slice. So that's why it's important to kind of go through slice by slice and see where these articulations are. Subsequently, as we're kind of at this region now, I want you to note, all right, here is the abdominal aorta, and I want you to be able to see how that branches off and to form the renal arteries as well. So you can see that connection right in there with the renal artery on the left and the renal artery on the right. So right and left are there, demonstrated pretty well respectively. And you can see that anterior versus posterior position. So the renal vein would be a little bit more on the anterior side than the renal artery would. So you can be able to differentiate, be able to see those points of connection kind of as we channel through. So including, you can see that point of connection right there then on the right side, so the right renal vein. So those are, the important structures kind of going forward. You can see like IVC, abdominal aorta, you can see that point. And then eventually as we continue to kind of go down into these pelvic structures, you can start to see those bifurcation points as they kind of split off and go their separate ways throughout the rest of the body. So nonetheless, those are some important vascular-based structures. The other vascular-based structure that I really wanted to emphasize was the portal vein, and you can actually see that structure right in here. So you can see it quite well. You kind of see how it's carrying over there respectively. So portal vein is one to kind of note. You can see, like I said, see where it's at pretty well here. So in a slice like this, be prepared to be able to identify a portal vein, be able to identify the IVC and the abdominal aorta. So you can see those respectively there kind of as we channel through. In terms of solid organs, a lot easier to be able to visualize these solid organs, I think, of the abdomen and really any other area. And you can see the structure of the liver extremely well here. So you can see primarily what is the right lobe of the liver. You can see kind of the left lobe of the liver as well. Right in there. So falciform ligament is not as identifiable as it is in some scans, but nonetheless you can see it. Other areas to kind of note as focusing still on the liver, you can see that posterior structure of the gallbladder formed right there. So you can kind of see that and follow that down as well. So this gallbladder isn't huge by all means. It's only available on a few of the slices, but nonetheless, you can kind of see where it's at. And like I said, utilize the localizers to kind of keep that frame of reference so you see where it's at as well. Other structures, though, to kind of break down, we'll touch on the spleen first. So when you start to see this structure here, that is the spleen. So not to be confused with the structure of the stomach. So you can see here is the structure of the stomach. Posterior to that is the spleen. And you can see even that the sliver of lung back here in the posterior region of that lung here. So we can be able to identify that. So continuing to go down though, you can see the spleen, you can see the vasculature supply, the splenic vessels here as well, but I'm not going to hold you really responsible for that one, just the spleen in general we can see. Continuing to kind of go back up, I want to touch on some other structures. So we've talked about the crus of the diaphragm here before, so we can be able to see those structures, but that's going to be something that's going to be helpful for us to be able to identify the adrenal glands. So the adrenal glands on both sides respectively, typically we can expect to see the left one as we pan down before the right one, just because of the proximities and respective positions of the kidneys. So you can see right in here is actually the start of the renal artery. So just kind of want to go in and out with the mouse so you can see that. Adrenal gland, I'm not sure if I said renal artery there, but it's the adrenal gland itself. So we can see that kind of that triangular pattern right in through here. We can be able to see that. So the left adrenal there, still see it, still see it, still see it. And then if we look here on the flip side, follow the crus, see that right near the crus is this structure here. You can see the formation of the right kidney over here. So anterior to that, you can see the adrenal gland. So definitely on this particular scan, you can see the left adrenal gland a little bit better than the right adrenal gland, but nonetheless, you can see both of them there respectively. Then just to kind of highlight some of those kidney-based structures, we can see, let's just go top to bottom again. We can start to see the left kidney kind of coming down, 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 down. And you can see the position of the hilum is going to differ, from patient to patient. So you can see kind of that bean shape right in through here. So there's the hilum. The bright contrasted structure would be the structure of the ureter. So we can see where that structure is located there respectively. And you can kind of follow the ureter down, 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 down. And the contrast here, it's while it's a with contrast study, it's really not identifying the contrast on this particular phase very, very well at all, because you kind of lose out on the ureter, but it is right in there. Subsequently, you can kind of see how it follows and channels down the psoas muscles here as well. So you can kind of see it here and there. It's a little bit spotty, but eventually it will then transition down into the bladder. So those are really kind of the important structures more than anything else. Of course, understand the area, region of the hilum where those vessels are entering and exiting. And you can see, yes, the renal veins, renal arteries, and the ureter in those respective areas there accordingly. So other structures to kind of talk about, they're really the only other structure that I haven't truly mentioned is the bowels. So you can start to see as we kind of go down, we'll see the structure of the stomach here, and you can see the air-filled stomach. So air is just rising to the most anterior portion since the patient is recumbent in a supine position. You can be able to see that air there respectively. You can see the structure of the stomach. We can kind of transition and follow it over, and you can really start to break down the structures of the pancreas through this region as well. So kind of going through, you can kind of see that transition point right in through here where the duodenum would be, the pancreas would be, then respectively here, here, and then so on and so forth, kind of going through that region. So you kind of can see that the area of the pancreas really well, kind of right through this region. So stomach, pancreas we can see, but really to truly focus on some of these other bowel-based structures, not great. You can see the large intestine. You can kind of see what that structure looks like. You can see kind of those Hofstra markings associated with the large intestine. But you can see just purely based on body habitus of this patient, this patient's pretty small. So, the bowels are wedged in there. So it's not as clean as, a hypersthenic patient where you're seeing those true separations of those bowels, and you really can see that classic appearance of where the transverse colon is versus where the ascending colon is respectively. You kind of look at the patient just on the scout image, and you can kind of look at actually the loops of bowel, and you can see how loopy it is for this patient, which is very, very classic for a asthenic based patient, and that's what we're really seeing here. So not classic by any means, and bowels are pretty difficult to look at in general. So I don't want to put an overemphasis on the structures of the bowels themselves kind of at this point, but definitely know the stomach and know some of these other structures that I've kind of highlighted and emphasized kind of going forward. If you have any questions, be sure to let me know. Thanks a lot for watching.